So starting with the skull, we have the frontal bone and the parietal bones with the sagittal suture and the coronal suture, and the occipital bone, where there is the lambdoid suture, the foramen magnum, and the occipital condyles, and the temporal bones, where there's the squamosal suture, the mandibular fossa, the external auditory meatus, the mastoid process, the zygomatic process, the styloid process, and then the sphenoid bone on both sides, and the sphenoid bone here again. And then we have the sella tertia and the optic foramina. For the ethmoid bone, we have the crystal galli and the cribriform plate and the olfactory foramina. And then we have the perpendicular plate, the vomer bone, which we can see here and back here, and the inferior nasal conchae. Of the mandible, we have the ramus, the coronoid process, the mandibular condyle, the mental foramen, and the mandibular foramen. For the maxilla bone, there is the palatine bones, the zygomatic bones, the lacrimal bones, and then the nasal bone, and the sutural bone here. Here are the three ear bones, the malleus, incus, and stapes, and the hyoid bone with the greater and lesser horn, and the sternum with the jugular notch, the clavicular notch, the manubrium, the body, and the xiphoid process, and the sacrum, and the coccyx. Here is a cervical vertebrae. There are 7 of these in the spine. So here's the body, here's the pedicels, the transverse process with the transverse foramen, the spinous process, and the laminae, the vertebral foramen. And here is the atlas and the axis. So we have the vertebral foramen, the dens, the transverse process, and the transverse foramen, and the spinous process. Here's a thoracic vertebrae. There are 12 of these in the spine. So here's the body. Here's the vertebral foramen, the laminae, the spinous process, the transverse process, the lateral articulating surface, the superior articulating process, the inferior articulating process. And if this were stacked on top of another, there would be the intervertebral foramen, which is like the hole in the middle. So I can pretend that this lumbar vertebrae is another one. So there would be a hole in the middle. That is the intervertebral foramen. Here's a lumbar vertebrae. There are 5 of these in the spine. So here's the body. And here is the pedicels, the vertebral foramen, the laminae, the spinous process, the transverse process, the superior articulating process, the inferior articulating process, and again, if they were stacked, there would be the intervertebral foramen with a hole in the middle between them. Here's the clavicle with the sternal end and the acromial end. Here's the scapula with the acromion process and the coracoid process, and the glenoid cavity. And here's the spine with the supraspinous fossa and the infraspinous fossa and the subscapular fossa and the medial border and the lateral border. Here's the humerus in the upper arm. So here's the head and the lesser tubercle and the greater tubercle and the intertubercular groove and the surgical neck, the shaft, the deltoid tuberosity, the rough area, and the nutrient foramen, hard to see, but the little dots in there. And then we have the capitulum and the trochlea and the medial and lateral epicondyles and the olecranon fossa. Here's the radius, so the head of the radius and the styloid process. And here is the ulna. So we have the olecranon process, the trochlear notch, and the radial notch, and the styloid process. For the hand, we have the carpal bones, the metacarpal bones, and the phalanges at the top, and then a proximal, medial, and distal for all of the other 4 fingers. For the pelvic bone, we have the acetabulum, and then the ilium, where we have the iliac crest and the sciatic notch. For the ischium here, we have the ischial tuberosity and the ischial spine. And of the pubis, we have the symphysis pubis, the aperture foramen, the hole, and if there's another one, then there'd be the pubic arch at the bottom, like this. So here we have the femur. So we have the head and the fovea captus, the hole, and the neck, and the greater trochter and the lesser trochter, and the linea aspera, and the lateral condyle and the medial condyle. And if it was articulated, here's the patella. For the tibia, we have the tibial tuberosity, the intercondylar meniscus, and the medial malleus. And with the fibula, we have the lateral malleus. Of the foot, we have the talus, the calcaneus, the tarsal bones, the metatarsals, and the phalanges.